Welcome back to the Navigating Healthcare series. I'm Dr. Page, the best guy to see on the worst day of your life. Today we're going to be discussing a very complex issue. What do you do when you're having problems with your physician, with your nurse, or with your healthcare system? What can you do? Once again, we've talked about in the first video how you are taking control of your healthcare, becoming your own healthcare advocate, how you're building a healthcare team, how you're preparing for visits. But what do you do when that seems to break down? What are your options? And I want you to realize today, in the United States at least, you have a great opportunity to find a relationship with a doctor that works well with you. There are some countries, for example, like Niger, where I go and train residents in a hospital. You don't have a lot of options. There's one surgeon for 200,000 patients. And so, but here in the United States, it's a little bit different. And so, everybody has different values. Everyone has different ways of communicating. And so I just want to encourage you that if you're having problems communicating with your doctor, and if that relationship is beginning to break down, then there's nothing wrong with finding another physician. Being on the other side of that equation as a physician, sometimes I've been very happy that people have went to another doctor to find their health care. It's been a relief. But I just want to give you some basic questions that you need to ask yourself before you do so. First of all, is there a loss of trust? Has the physician done something that has made you lose your sense of trust and assurance that he's acting in your best interests? Do you feel as though maybe the doctor has lied to you about something, or maybe withheld pertinent information about something? Is there a problem with your physician being available to you? Sometimes it's not the physician. Sometimes it's actually the office that he works in or the system within he works in. Sometimes you never get a call back about a lab test or a study. Sometimes you never get a follow-up for an appointment. The next question I think you need to ask before firing a physician is there give and take? Is the physician talking down to me? Or is the physician not listening to me? Along that line also, I think you need to ask yourself, do I have an unrealistic set of expectations? Am I expecting from my physician to walk on water? Once again, we need to realize that we live in a broken world, and in a sense, we're all broken. We live in a broken healthcare system. And so, am I asking too much from my physician? Good questions to ask. Before you fire your physician, I want you to really try to stop and communicate with your physician about the breakdown of your relationship. It's important for both you and your physician. Sometimes, as physicians, we're still along the way. We're still learning in the process. And sometimes you may help another patient by sitting down and just talking with your physician and saying, hey, this is why I'm thinking about leaving your practice and going to see another physician. I think the physician often needs to know how he can do things better. Once again, we're still in process. We're still learning. We're still growing, even as physicians. And so I think you owe that to your physician as far as helping him understand exactly why. And then another very practical thing that you need to think about before you fire your physician and before you leave is, do you have another physician? So often, once again, in this relationship, the patients have more rights than the physicians do. And so if you come into the emergency room, or if you need a refill on your medications, the physicians are obligated for, a month or so, depending upon each state's requirements. But I think you need to think ahead of this, and, before you fire your physician, you need to realize that it may be worse off by getting a new physician. Once again, these are difficult things when you're having a breakdown of communication and a breakdown of your relationship with your physician. So I want to encourage you that, once again, there are opportunities with every obstacle that we face. Thanks for joining us in the Navigating the Healthcare System. Once again, we have just touched the surface of all of these issues. I'm Dr. Page, the best guy to see on the worst day of your life, and thanks for joining us in the Navigating Healthcare series, learning to become your own advocate in healthcare. And I just want to encourage you that you can do this, and I wish you Godspeed. Thanks for the honor of being with you in your journey.